And I want to report confidently that we have budgets for the interns this year, and we will be paying where there is no contention. And I believe we are not going to have any contention. So the interns that are in the field who have been working for months on end will be paid, and we are processing their payments so that we are able to move away from that again. And we also promised to give a conditional grant to the counties, 3.5 billion shillings conditional grant to the counties, and already 1.75 has been demarcated, and Treasury has already written to us confirming that during supplementary 2 we will be able to give the basic salary arrears as a conditional grant to the counties so that they may pay their staff. That was one other thing that we had already agreed. And more so the payment of postgraduate studies, and especially when there was no contention, the lists were provided to the ministry and they were paid for to the universities where they are studying. That is another thing that we had agreed. In the return to work formula, we agreed that the basic salary arrears that is owed by the counties to the doctors is going to be given as a conditional grant by the national government. And already Treasury has written to the Ministry of Health that we will be allocating 1.75 billion shillings in this financial year, because the 3.5 billion was to be paid within a period of 2 years. So this financial year, we will be having 1.75 to pay the basic salary arrears that is owed by the counties to the doctors. We have seen an overlap in terms of agencies having overlapping mandates. So what do we do about them? Do we merge them? Do we go ahead and build other agencies that are going to manage them? So we would really want to see this. And finally, issues to do with data. We want sharing of data, whether it is from private facilities or faith-based facilities or the public facilities. It is important to share data of the human resources that are working in this country. And this is going to enable us have good data development, because sometimes in areas we have incomplete data. We may not even know probably limitations in terms of coordination because of the data sharing amongst the health stakeholders is not very adequate. Multiple incompatible information systems for management of human resources for health data, which is very, very critical. Therefore, I want to say it is a good thing, and it is forward-moving thing to have a task force to relook into all these areas of advancement for human resources for health.
And the numbers, how many are they?
Oh. Counties of 1.7